From baseball to 4th of July celebrations, COVID continues to impact just about every facet of our lives. Today, the state is reporting 460 new cases in Michigan in the past 24 hours. That's down from yesterday's 543, which was the single highest day number since the end of May. But today's number is also still higher than we've seen in weeks. 3 more people also died. Thankfully, that number, though, is down from yesterday. Governor Whitmer hoped to bring the state's reopening to phase 5 by now, but with the way things have gone, more businesses are not going to be reopening. She pumped the brakes this week on that. Many bars had to stop indoor service. Theaters and gyms also remain officially closed. Experts say determining how many people have died from COVID-19 is not as easy as it might seem. A new study finds the number of deaths in the early months of the pandemic may have been underestimated by nearly 30%. Our Dr. Frank McGeorge here now with a closer look.
Researchers looked at the total number of deaths between March 1st and May 30th of this year and compared that to the historical number of deaths in the same time frame. They found there were roughly 122,000 more deaths than expected. Now, a large portion of them, 95,000, were directly attributed to the diagnosis of COVID-19, leaving 27,000 excess deaths not clearly explained. Now, here in Michigan, they identified 6,100 deaths above what should have been expected, with roughly 4,800 attributed to COVID-19, leaving over 1,200 additional deaths that were incompletely explained. Now, the authors believe these additional deaths may have been from multiple sources like unrecognized and therefore uncounted COVID-19 infections, as well as medical conditions that were worsened by the pandemic due to less access to medical care. Now, on that note, another newly published study, also in JAMA, looked at medical causes of death in 5 of the hardest hit states, including Michigan, New York, New Jersey, Massachusetts, and Pennsylvania. Now, during the COVID-19 peak in March and April, deaths from diabetes rose 96%. Heart disease deaths, 89%. Alzheimer's deaths rose 64%, and stroke deaths rose 35%. The authors actually suspect some of these deaths occurred among people unwilling to seek medical care because of their fear of the virus. Now, the important lesson for everyone as COVID cases continue to surge nationwide is chronic medical conditions will worsen if they aren't attended to, and emergencies, well, they're still emergencies even during a pandemic. Back to you.
All right, Doc, and those COVID